Team Blaze, good evening. I'm Colonel Samantha Weeks, commander of the 14th Flying Training Wing, and I'm coming to you tonight to give you an update on coronavirus. Today, I issued a public health emergency for Columbus Air Force Base based off of the number of coronavirus positive cases that we have in our community and the increasing number from day to day across the state of Mississippi. The bottom line is we need to continue to take care of ourselves and take care of each other and take care of our families so that we can protect the force. We also need to take prudent actions so that we can protect our mission as a flying training wing for national defense. And finally, we need to align our operations with that of our city and county and community so that we can support the whole of government efforts in fighting coronavirus and flattening the curve. In addition to the public health emergency, I have also increased our health protection condition from Bravo to Charlie. Things that you will see across the base that will change include our restriction of movement will continue to be from your place of home to your place of work in the city in with which you live. But we'll also align our actions with the city of Columbus's restriction from 21 March. In that, the mayor stipulates that gatherings will be 10 people or less, and we will do that to the max extent possible that our mission allows. The waiver authority for anything greater than 10 people will be the squadron commander. Additionally, the city has imposed a curfew from 10 p.m. to 6 a.m. to mission essential travel only, and we will follow that again to the max extent that our mission allows. For base access, from the 23rd of March until further notice, we will restrict it to DoD ID card holders only. Group commanders will be the waiver authority for that because I do understand that your mission or your family may have a requirement for a non-DoD ID card holder to have base access. So please work with your squadron and group leadership if that is applicable to you. We're going to continue to maximize our telework capability for our military and GS civilians. I ask our contractors to work with their company's leadership to meet CDC guidelines for social distancing while maximizing telework opportunities, and realize the 14th Contracting Squadron is there to assist you. For the Mission Support Group, we are going to see community services continue to close across the base. As of 23 March, the gym will be closed until further notice, as well as Freedom Park and Little Blazer Park. At our Child Development Center and Youth Center, we'll institute a screening process for children who utilize those facilities, as well as review our families that need that to ensure that we are minimizing population to those that have a mission requirement to use the CDC or Youth Center. Our operations group will reduce the length of our fly day and our fly schedule so that we can protect our force and protect the mission. We will team people into Team C and Team B, the same letters that are on the tail flash of all of our aircraft, and fly around the flagpole on a daily basis so that we can ensure that as this disease spreads, we have the ability to continue the mission with our concept of operations. Our medical group is going to continue the screening process that was instituted on Friday, 20 March, so that we can protect you, protect our providers, and protect the facility. We're asking if you have any COVID-19 symptoms to please call in to our nurse hotline first to receive medical care and recommended steps over the telephone. That number is 662-434-CARE, C-A-R-E. You will also see that we're going to continue to reduce face-to-face visits by having a nurse telephonically triage each patient prior to scheduling an appointment. In addition, many of those appointments will be virtual encounters to provide evaluation or healthcare management over the phone. For our flyers and controllers, the rack is going to be reduced to once a day at 8 a.m. and the rack will be for return to fly and return to control only. This is going to assist us in establishing the morning to be for healthy patients that need medical care, and the afternoon will be for sick patients needing medical care. So sick call will only be in the afternoon. And again, I want to reiterate, if you are concerned at all about any exposure and symptoms that you have for COVID-19, please use the nurse hotline first. Our lab in radiology will only be available for medical necessity, and our dental services will be for pre-deployment and emergency care only. The pharmacy is where we're asking for your support in the biggest changes. The pharmacy is recommending that all patients have a 90-day supply for routine medication. If you don't, then we're going to ask you to start now by placing an e-script or a mail order prescription. Additionally, to decrease face-to-face encounters in the pharmacy, we're asking all patients to activate their routine medications, whether that is a new prescription or a refill prescription, by calling the pharmacy line first. Those numbers are 662-434-3122 or 662-434-2168. Furthermore, we're asking our beneficiaries to utilize our Express Scripts for their prescriptions or request that your medication is transferred to a pharmacy in town that provides drive-through services so you can maximize your social distancing and minimize your exposure to common places. On our app, we have information on how you can go about setting that up. With this in mind, our automated refill line is going to close as of 23 March, and we will turn that into a telephone interview. So if you have questions or would like to transfer your prescription to an off-base pharmacy, call 662-434-2168 or 662-434-3122. The bottom line here is the medical group is trying to care for you and your safety first and foremost, as well as caring for our medical providers and ensuring that our medical treatment facility provides that care for you through the continuation of this virus growing across our community. Lastly, I want to thank each and every one of you again for your individual actions to flatten the curve and kill this virus. Many people have said that our country is at war right now, and I adopt that mindset so that I can understand the individual responsibility and accountability required of me and my family to make sure that we take the necessary and precautionary steps to kill the virus, protect ourselves, and truly flatten the curve as fast as possible. We're here for your questions, so please let us know what you need. Thank you very much and have a good night.